Now we will talk about the condition known as the acute suppurative parotitis, and then we will discuss how acute suppurative parotitis will present itself, what are the clinical features of acute suppurative parotitis, how we can investigate and treat this condition known as the acute suppurative parotitis. Acute suppurative parotitis is more common in elderly, debilitated and dehydrated patients. So elderly patients who are weak and debilitated and also dehydrated, which are not fully hydrated patients, they can have acute suppurative parotitis. Parotitis is for the inflammation of the parotid gland. It's acute, short-term, and suppurative means there is infection, abscess formation, pus formation associated with this condition. That's why it's known as the suppurative parotitis. So patients who are affected, old age, elderly, those are weak, debilitated, and dehydrated. There is dry mouth predisposing factor. Dry mouth is the predisposing factor that can lead to different infections associated with suppurative parotitis. The common causative organism or the bacteria associated with this is the Staphylococcus aureus. Route of infection of the acute suppurative parotitis is from mouth through the Stenson duct. So from the mouth through the Stenson duct, inflammation reaches the parotid gland and cause parotitis. So oral condition, oral hydration, oral hygiene is very important for the protection or prevention of this acute suppurative parotitis, because the infection is going from the mouth through the Stenson duct. And here you can see the swelling and the suppuration. Clinical features of this condition are there is severe pain, very bad severe pain, and there is enlargement of the gland, enlargement of the parotid gland since it's parotitis. Here you can see this is the parotid gland in front of the ear in the mouth. So there is enlargement of the gland, and there is painful jaw movement also because the whole area is swollen, painful, and the movement of the jaw is affected and it's painful. Swollen and red opening of the Stenson duct. The opening of the duct is red and swollen because that's the site of the spread of infection or bacteria from the mouth to the parotid gland. Pus formation, suppurative. Suppuration is the pus, so there is formation of the pus at mainly the site of the opening of the Stenson duct from where the infection is spreading. And then there is fever, and the patient is toxemic, ill-looking appearance of like a toxemic patient, very high fever, tachycardia, malaise. All these are the features that represent that there is a patient is toxemic and there is toxemia. So all these are the clinical features and presentation of the condition known as the acute suppurative parotitis. Investigations are the leukocytosis. As with any infection, whenever there is infection in the body, the white blood cell count is increased to fight that infection. So here same, it's a bacterial infection caused by Staphylococcus aureus. There is increase in the number of the white blood cell leukocytosis. There is increase in polymorphs, identification of causative organism, the culture of the causative organism, the growth of the causative organism is helpful in the proper treatment of the condition. So all these tests are performed. Establishing sensitivity of organism by culture, blood and pus. So culture is the method by which the causative organism can be grown, and we should know exactly what's the causative organism when we culture the pus and the blood. And once we know what's the causative organism, then specific treatment, specific antibiotics that are effective against that microorganism is started, and then treatment or recovery is fast. Treatment is antibiotics, usually IV route is in the beginning. Adequate hydration, because dehydration or dryness of the mouth can lead to this infection. Promoting salivary flow, oral hygiene and surgical drainage of the pus, all these are important. Here you can see this is the site of the parotid gland, which is all very red, swollen, and looks like it is tender also because there is redness and swelling. So IV antibiotics, proper hydration, and then promoting flow of saliva, oral hygiene, and the drainage of the pus or abscess is important by a cut, incision, and then putting a small, sometimes the drainage tube to drain the abscess. So this was all about the acute parotitis, which is due to Staphylococcus aureus, and the spread is through the oral route by the Stenson duct, and the patient is very ill looking, febrile and toxemic, and treatment is by IV antibiotic and by promoting the general health and the general condition of the patient. Thank you for watching sqadia.com.